This is the push-up test. The purpose is to test the muscular endurance of the upper body muscles, such as the anterior deltoid, the pectoralis major, and the triceps. Muscular endurance is defined as the ability to contract the muscle repeatedly over a specific period of time without undue fatigue. The demographic of the subjects are adults aged 18 to 35. The fitness level is moderate, and the ability is non-able-bodied. More specifically, an individual who uses a wheelchair. The aspect of fitness that is being tested is muscular strength / endurance. For the equipment, all you need is a bench. A mat is optional, which can be placed underneath the patient's hands. A notebook or a laptop can be used to record the data. And for clothing requirements, just proper gym attire. Finally, for the venue, anywhere with an accessible bench, such as a fitness center or in a hospital setting. As the test administrator, you should be clear when explaining the push-up test, and be sure to ask any questions if required. If there are any errors during the test, you can call for a redo, and make sure not to record the previous data. The administrator will count the amount of push-ups, demonstrate proper form if required, and make sure the client can properly do a push-up. As the administrator, you should tell them some key points, such as having the hands underneath the shoulder and having the hands face forward, as well as telling the patient to maintain neutral spine, which is keeping the back straight. Be sure to tell the patient the correct pivot point for the starting point, which is by having the hips on the bench. Finally, you will tell the patient that they will do as many push-ups as they can until they are unable to maintain the correct technique within 2 repetitions. As the subject or the patient, you should listen to the test administrator as they explain the test and ask any questions if you do not fully understand. Be sure to perform the test correctly and to the best of your ability. Do not leave until the administrator has finished recording the data. As the subject, begin in the starting position by having your hips on the bench, which is the pivot point. Have your hands underneath the shoulders and having your hands facing forward, not outward or inward. Begin when the administrator tells you to go. Remember to do as many repetitions as possible with correct form, and make sure to not pause between repetitions. Reasons for termination. This can include improper starting positions. So this can be having the hands outward or inward and having the hands below or above the shoulders. Some other reasons include not maintaining neutral spine, pausing in between reps, and not getting low enough, not getting the correct depth required for the proper push-up form. For data collection, please use a notebook or a laptop. For troubleshooting, you can change the pivot point. Instead of having the hips on the bench, you can have the knees on the bench if it is too easy. As a backup plan, if the patient is unable to do a single push-up, a plank can be performed with the same starting position as the push-up. For this project, All patients will do the push-up test.